There has been a trend over the last few decades of more and more isolation and loneliness in society. So what we're seeing now is an intensification of an ongoing trend.
How are you coping with the pandemic? Be honest. Social distancing and being away from friends and family is beginning to weigh on the mental health of Canadians, with a new Angus Reid poll reporting higher levels of loneliness during the pandemic.
There are many people who have been thrust into this situation without any prior notice, who are accustomed to a very rich and varied social life, who are accustomed to seeing their family and friends and to be out enjoying the places that they live. And mostly these are millennials, and for people and they may not have developed the psychosocial resources to cope with that alone time.
Angus Reid asked Canadians how they're handling time away from friends and family. The number who reported both loneliness and social isolation rose from 23% last year to 33%. 1 in 5 said their mental health is poor or very poor, with that figure higher among women. These findings are backed by Morneau Chappelle, which found mental health among workers has declined, and people who reported loneliness as a concern had some of the worst mental states.
It's natural for people to feel depressed and anxious because they don't know what the future holds, right? So because of those measures, and that it's natural for people to feel lonely, and that will have the impact on your emotional and mental health in terms of depression and anxiety.
Without the ability to interact normally, video calls have become a preferred way to communicate. While the Angus Reid poll says people's enthusiasm for video calling is waning, research has shown that those calls are healthier than the endless scrolling of social media that's become normalized in society.
There is a difference between talking on the telephone, talking on Skype, Zoom, Microsoft Teams, face to face, where you're laughing, you're sharing things. You can actually conduct activities together. We all know people who will be cooking and they're talking to their sibling on Skype, or they'll be even studying together, and there'll be a silence, but they'll be talking now and again. That is definitely supported by research as much more helpful than silently going on websites and observing other people putting their My Fun-Filled Life version of reality forward on social media.
Now, mental health professionals emphasize that Canadians need to get to know what is the difference between a normal response to a stressful situation and what could be a sign of a more serious depression. If you're showing signs of depression for more than 2 weeks, they recommend that you contact a mental health professional and see if you need more help. In Ottawa, Xiaoli Li, City News.